Let's get started. Good morning and good evening to our international students. My name is Carson Ross, and I'll be presenting the midterm briefing for our bill, HR 3771, the Advancing Emergency Preparedness Through One Health Act of 2019. First, I'll just briefly thank my team for all of their hard work this semester so far, and Professor Rosen, our faculty advisor, for her support. To begin, I'm going to explain what is the issue our bill is trying to address, and then I'll go through the objectives of the bill, one of which is to create a One Health framework, so I'll give some context to what that is, and then I'll go through the specific legislative mandates in the bill, and then I'll explain our program design for the first year of implementation and conclude. I'd like to begin by describing a global issue that we've all been personally engaged with since the beginning of this year, which is, of course, the threat of zoonotic disease. Zoonotic diseases are pathogens that are able to pass from animals to humans. The CDC estimates they account for 75% of newly emerging infectious diseases, 80% of agents with potential for bioterrorism, and more than 2 million deaths worldwide each year. Human actions, from unsustainable agricultural practices and an unregulated wildlife trade, both of which we've heard about already today, as well as urbanization and deforestation, increase the interface between animals and people, which has led to a significant and mounting concern around human health, as well as economic costs and national security. I don't need to go very far to illustrate the severity of this problem, since we're currently experiencing the cost of lacking a national preparedness strategy. In the last 6.5 months, over 1 million people have died worldwide from COVID-19, including over 210,000 Americans. We've experienced the highest unemployment rates since the Great Depression and witnessed overwhelmed hospitals, shocks to the food supply, and most recently, our national leaders up to the highest office falling ill. HR 3771, the Advancing Emergency Preparedness Act, Through One Health Act, was introduced in July of 2019 with the overarching goal of creating a framework which would prevent, prepare, and respond to zoonotic diseases based on One Health principles, which recognize the interconnectedness of human, animal, and environmental health. The framework created as a result of this bill will define the roles of federal agencies, state and local partners, and coordinating bodies to address emerging zoonotic diseases through preventative measures such as surveillance and improved environmental practices, preparation for outbreaks, like ensuring adequate medical supplies are available in hospitals and health centers, and managing an effective response with things like clear lines of communication for public health information and creating flexibility in the food supply chain. While the bill calls for the establishment of a coordinated One Health framework, the One Health approach itself is not a new concept. The integrated approach has actually been growing in influence for decades, and it's already informing national public health systems around the world. Several agencies within the US also draw on the approach, such as the CDC's One Health Office, USDA's One Health Coordination Center and APHIS, as well as the USAID program PREDICT, which was tasked with monitoring emerging infectious diseases, increasing workforce capacity, and improving international and national research laboratories to work with zoonotic infections. That is, until its funding expired this past summer. Right now, we have existing One Health efforts in specific agencies, but many agencies that aren't traditionally thought of as being connected to public health, like the DoD, Department of Commerce, or Homeland Security, are very much impacted by the threat of zoonotic disease. So in order to be truly prepared for emerging threats and have an effective response, each of these agencies needs to institute One Health into their activities, and there needs to be coordination among One Health efforts across agencies. So the bill mandates that within 1 year of enactment, the Secretary of Health and Human Services and the Secretary of Agriculture, as well as many departments and agencies which are named in the bill, shall develop, publish, and submit to Congress a national One Health framework for coordinated federal activities under the One Health program. But what will the framework entail and who will be involved? According to the language of the bill, the process will start by identifying what already exists within the government in relation to One Health and disease preparedness. So that would include the offices I mentioned on the previous slide. These agencies need to establish 10-year federal goals and priorities, specifically around improving scientific understanding of the interconnectedness between human, animal, and environmental health, identification and surveillance of priority diseases and disease emergence hotspots, prevention of transmission between humans and animals, improved coordination and collaboration for data sharing, engaging in joint fieldwork and research efforts, as well as goals focusing on workforce development around prevention and response. The enactors of the bill will then need to identify and expand partnerships to include additional stakeholders who aren't specifically mentioned in the bill, such as Indian tribes, NGOs, academic institutions, private entities, and then they'll identify best practices moving forward. So the language of the bill appears to assume a top-down approach, whereby the secretaries lead the development of the framework and dictate the actions taken by those directly below. In this case, that would be the federal departments named in the bill, like the DoD, EPA, USAID, and many others, which would in turn manage state and local agencies. However, a top-down approach can be slow to integrate state and community-specific emergency response efforts. We've actually seen these inefficiencies play out during the COVID-19 pandemic, whereby the CDC and White House have been leading a centralized response. So to address some of these challenges, we also explored a bottom-up approach, which has the advantage of tailoring response to specific emergency needs from the communities from which the assessments originate. But this approach can be time-consuming, resource-intensive, and can lead to a high risk of developing contradictory subplans. So for these reasons, we decided on a counter-current approach. In this case, information is shared in a centralized and decentralized fashion, where the secretaries co-determine the approach and rely on information received from below to create actionable steps. Some of the advantages of this approach include having clearly defined vision for advancing emergency preparedness, faster delivery of One Health assessments, and a reduced risk of duplicating public health threat communications during emergencies. Of course, there are some disadvantages to this model as well, in that it necessitates a high level of coordination and self-regulation across agencies, and the agencies will need to develop deep functional and technical understanding of the One Health approach. And they'll need to be committed to an open exchange of information and resources. So with all these moving pieces and various lines of communication, what does our counter-current approach look like? At the top, coordination will be conducted by a federal steering committee. The committee's activities will be overseen by the Secretary of Health and Human Services and the Secretary of Agriculture as outlined in the bill, and will be made up of members of each of the agencies described in the bill. Within each of the relevant agencies, there will be a coordinating One Health office. The office will involve membership from each agency's various departments and a liaison to communicate with local and regional offices to keep the agencies up to date on events taking place on the ground, like potential outbreaks or new developments in research. As I mentioned, several of the agencies already draw on the One Health approach, but expanding One Health offices to all agencies and departments will improve public health practices and awareness of the complex connections between human, animal, and environmental health and their impact on all sectors of society. The bill, HR 3771, is built on the 3 pillars of prevention, preparedness, and response. So there will be a specialized task force dedicated to each of these goals. The task forces will include members from One Health offices from each agency relevant to that work, as well as membership from local partners. For example, the prevention task force would include representatives from government agencies like USAID, APHIS, the CDC, FDA, among others, to conduct surveillance activities, communicate potential health risks, and develop broad spectrum drugs. But it would also work with non-government partners like UC Davis, Columbia University, and the EcoHealth Alliance, all of whom were invaluable to the success of the PREDICT program, which identified over 1,000 strains of diseases with pandemic potential. And bringing in outside expertise can help ease the burden on government agencies while adding an additional layer for monitoring and accountability. This model allows for the interagency collaboration to take place at both the highest level and the steering committee, as well as on the ground in the task forces conducting fieldwork, training, and research. This is the heart of the CounterCurrent approach because the multiple levels of collaboration across sectors allows for faster and clearer communication, which is an absolute necessity for effective emergency response. Put briefly, One Health is a simple and powerful concept with a complex implementation process. While there are some limitations to the CounterCurrent approach, overall, it's able to address the complexity of needs in advancing emergency preparedness across sectors at the local, state, and federal level. It allows for greater flexibility through interagency collaboration on multiple levels and integrates the One Health approach into every agency and department's internal system. Over the next few weeks, we'll be expanding our program design to include a specific staffing plan, organizational chart, a budget, and a calendar for implementation. Thank you, and now I can take some questions.
Very nice work, Carson and group. Any questions from the class or our guests?
You guys can raise your hands or type them in the chat box.
Okay, I guess the group's all questioned out. Is that right?
Seems like it.
Okay, Carson, very nice job.
I have a question, sorry.
Okay.
There's Jenny.
Hey, great job, Carson. I guess I just wanted to know, can you elaborate on the challenges of implementing this program? You already mentioned a lot of them because we have a good example of real life what we're going through, but the challenges of implementing it and yeah, in terms of, and what you went through in terms of how to choose the program design you decided on, and if maybe if the bottom-up approach is one of the solutions to how to address the challenge given the current situation of how things are being implemented.
Sure, there's definitely no shortage of challenges with this issue. I think that the fact that it's so relevant right now is sort of a blessing and a curse because we are able to see a lot of the things that do and don't work in emergency preparedness. So the really big focus of the framework is supposed to be that it encourages collaboration across agencies. And so what that says to me is that there are a lot of politics at play just because you know, we've seen what it looks like when agencies are or aren't willing to collaborate and openly share resources and information. So I think that was really what our focus was, is like, how can we create some like backups so that there's collaboration on different levels yeah, I guess to make sure that if it doesn't work at one stage, it is going to work somewhere else. So I think that was a really big focus for us. I do think that there's some promise just because we've seen how much it costs not to have an emergency response. So I think that it is sort of encouraging people to take the issue seriously, and that could mean that people will be able to overcome politics and collaborate on a level that needs to happen in the future.